Someone sprayed hairspray near me, and I ended up in the hospital having to have my heart shocked because I developed an irregular heartbeat from it. Another time, my face swelled. My hearing was gone. My eyes were swollen shut. It was extremely painful.
Multiple chemical sensitivity is a medical condition in which the person has become sensitized to chemical pollutants that are really common in the environment, that they used to tolerate, that the general population tolerates, but they now have symptoms provoked because of sensitization.
I discovered maybe about 10 years ago that might be what I had, and finally found Dr. Malott in 2012, and that's when it was finally diagnosed.
People often talk about, well, what chemicals are you allergic to? It's not an allergy. Antihistamines would not make any difference at all.
When people tell me that they don't believe in chemical sensitivity, my immediate response is to say that medicine is practiced according to science, not according to beliefs. It's not a religion. The medical evidence has accumulated over the last couple of decades, and is quite clear that there is a change in the nervous system. We see that these people are genetically different with respect to their ability to detoxify chemicals.
Just because you can't smell it anymore doesn't mean they're not there anymore. It just means that you can't smell them because the level is lower.
MCS is a recognized medical diagnosis by the Canadian Human Rights Commission. As a result, the people with a diagnosis of chemical sensitivity have the right to accommodation. Most effective treatment is to stay away from the chemicals that trigger off the symptoms. And that's really easy advice to give and a really hard lifestyle to follow because we live in a chemically contaminated world.
I've been very ill with it over the last 2-3 years, to the point where now I'm housebound. I went out to do a bit of grocery shopping a couple of days ago. That's probably the first time I've been out in maybe 10 days, and I'm still trying to recover from that. I've lost everything I own twice in the last year and a half because my things make me so sick.
I began to have this sensation that my face was getting numb on one side, and weeks went by and it was very profound. Felt like my ear was swelling closed, and it felt like I had tunnel vision in just this eye. And that changed my level of concern about the effects that I was having in my building. The newspaper did a story about me and my sick building, and in just a few days my phone was ringing and ringing, and 35 of the calls that came in were from people who had stories almost identical to mine.
It started smelling really strong. Sometimes it felt like your skin was on fire, and I just got sicker and sicker, and I guess at that point it was like somebody standing with a gun to your head and said, "You're gonna do something or you're not gonna live."
Welcome to my home. I'm camped out here because I've developed sensitivities to chemicals, and the only way that I've found to avoid the symptoms is to avoid the chemicals themselves. And there aren't many chemicals out here, as you can probably well imagine. And I've been out here in a tent, I guess, since February. It was a little chillier back in February than it is now. But I've been living in a tent for the most part for the past 8 years.
I've been living out of my truck for approximately 5 to 6 years. And thank God I'm short. You're afflicted with this, you know, it's like you have to figure out how to survive.
I'm Brandon Rowe, standing by a tent that is small and cramped, but for one Toronto woman, it's home. Her rare chronic disorder is forcing her to live outside because living in a normal house would aggravate her condition. She's pleaded with the city and the province for a safe place to live, but options are limited.
Concrete, glass, and steel are fine for me, but most of the other things in North American homes make me really sick. Drywall gives me asthma attacks.
Danny Storr is forced to wear this mask that filters out toxic air. She gets sick when exposed to commonly used chemicals. She can barely breathe after getting a whiff of a nearby laundromat.
Sorry.
Danny has a rare chronic disorder called multiple chemical sensitivity.
What is life like with this condition?
It's horrible.
Danny has been living with this condition for 5 years since it was triggered on a trip to Africa. It's forced her out of her job and out of her home. For months, Danny reached out to her local counselor, the city, and the province for support. She says they've tried to help her, but the options they've given her don't work. The Ministry of Housing says the building code does not directly address environmental sensitivities, including multiple chemical sensitivities. The building code does not permit dangerous materials that may be harmful to people, but does not require materials to be chemical-free. So there's no guarantee any community home or shelter would be safe for Danny.
Drywall and a lot of modern building materials are off-gassing those kinds of chemicals, so those will also make me really sick. So if I tried to go to a shelter, I would end up straight in hospital where the doctors don't know how to treat me. So that's why I'm outside.
An assistant clinical professor at Harvard Medical School, is the former director of occupational and environmental medicine at Massachusetts General Hospital.
Multiple chemical sensitivity, or MCS, is a multi-system disease that is characterized by symptoms associated with exposure to low levels of chemical vapors. These levels of exposure are commonly found in the ambient environment. Systems that are affected by MCS include the respiratory system, the neurologic system, the gastrointestinal system, the skin in some cases.
Hattie's trouble all started at work with a rash on her arm, and then the unexpected happened.
I decided to leave and go back to the nurse's desk. Before I could get there, I collapsed, and a patient had to go and get the staff.
I was having muscle spasms, and I'd be driving down the road, and I wouldn't remember where I was going or why. I found that I was having a lot of difficulty breathing. I'd feel a real heavy pressure in my chest, and it was almost like having something inside that was pushing against the chest wall, and it created a lot of pain. I also had a lot of pain in my spine.
I think my body just reached a level where, that was it. I just like I crossed, some sort of a line or something.
The next morning, Tony woke up feeling as if he had a chest cold, and a few days later, he was hospitalized. When he returned home, his health continued to deteriorate.
It's just exhausting, really, in the way I have to avoid just things that most people seem, things that seem so normal to most people.
I have great difficulty walking around the block or walking up a flight or two of stairs without being totally wiped out and in pain.
I developed symptoms like twitching, tremors, my hands would shake, my legs would shake, even standing, walking, sitting, whatever. My vision was blurred, and I'd get lightning flashes in front of my eyes. I didn't know anything about chemical sensitivities back then. I didn't realize what was making me sick. Finally decided I needed to see a doctor. I hadn't seen a doc in 10 years, and 15 maybe. I'm not the kind of guy that goes to the doctor very often. I went to see a doc, and the doc told me that she thought that I might have multiple chemical sensitivities. At that time, they didn't call it that. They called it an environmental illness.
When I'm talking to people, I don't remember everything, and then it will come to me later on. But I have memory problems.
I can go into a fit. I can feel nauseous and throw up. My throat can close up.
All of a sudden, it hit me, and I got lightheaded,
Roy's blood pressure shot up so high that the emergency room staff thought he was having a heart attack. He ended up spending 4 days in the hospital.
Lost my balance and got confused and got on my hands and knees and couldn't figure out which way to get back in the building.
Charles recovered, but his symptoms of brain fog, blistered skin, and muscle tremors continued.
I went for 20-something years going to the doctor, and every time I'd write down about the chemicals, most of the time they wouldn't even record it in my chart. They'd just write down I had sinusitis or you had back strain. And all the time it would be the chemicals that were making you hurt, and it would be the chemicals that were giving you a headache. In my case, I'd have blisters in my mouth and on my face and on my lips, and shortness of breath and confusion and muscle cramps and irritability.
Symptoms can be truly disabling. They interfere with a person's ability to engage in gainful employment. They interfere with a person's ability to use public transportation. They interfere with a person's ability to live in a multifamily housing unit. They interfere with family life. They are isolating, in short, so that individuals with MCS who are severely affected often feel very isolated. I see this in patients that I see.
You don't understand, and you can't get anyone else to understand what you're going through. It's depressing when you've been so active in doing things and socializing. You can't do that for fear that you may not make it out.
The asthma attack I had increased during the night. I used my inhalers. Went to bed anyway. Then my breathing got extremely bad. They sent a rescue unit to get me because I was in the rescue unit. I stopped breathing 3 times.
People just don't understand how sensitive you can be and how sick you can become.
One of the hardest things for me was to have my body essentially let me down on a continual basis over and over again, and worse, to the point where I just had to withdraw more and more to protect myself and keep myself from being excruciatingly ill.
Become totally disabled. My life is non-existent, really, in terms of, I mean, I have a life, but it really just, I exist in this one room in a flat.
This isn't easy, just being out here in the woods. It may look like I'm living the life of Riley, but and it's beautiful out here, but it ain't a walk in the woods.
Eventually, Charles had to quit his job due to his ongoing struggles with his chemical sensitivities, and the company he worked for dropped his retirement health benefits altogether. Charles now leads a life of isolation.
It's absolutely ruined my life. As far as who I used to be and who I am now, it's a different person.
Well, people tell me all the time that I look well, but I could be having a migraine at the moment they're thinking those things, and they would never know unless I told them. Obviously, there are symptoms of chemical sensitivity like rash or eczema that, you would see, but many and most maybe of the symptoms do not appear at all. So that's sometimes difficult for us, having an invisible disability.